Welcome back to our channel. Thank you for following our videos. Thank you for liking our videos, your comments, your shares, and everything. We really appreciate that. Today, we want to talk about anemia. Like we mentioned in our last video when we talked about the complete blood count. So, anemia is a blood disorder, so in which there is reduction in the blood's ability to carry oxygen. This usually occurs due to lower than normal number of red blood cells or reduction in the amount of hemoglobin present in the blood. So, the other name that we can call this, we can call it erythrocytopenia. What are the signs and symptoms that may tell someone that this person has anemia? There may be jaundice, then there may be red eyes. This usually occur in severe condition, and dizziness may also occur. Tiredness, headache may also occur. Shortness of breath, cold hands and feet, irregular or rapid heartbeat may also occur. There may be loss of appetite, there may be chest pain, there may be pale coloration or yellowish coloration of the skin, and also there may be sweating, profuse sweating, thirst and confusion may also occur. Palpitation and angina may also occur. So these are few symptoms and signs of anemia. Then what are the causes of anemia? So the causes of anemia is very vast, but we can categorize this into three: impaired, decreased red blood cell production. So when there's decrease or impaired production, anemia may occur. They also increase red blood cell destruction, that is hemolysis. So that one we call it hemolytic anemia. And at the same time, blood loss. So anemia may occur due to blood loss or fluid overload. So let's look at the impaired red blood cell production causing anemia now. So we know that for blood to be produced, there are certain required components, like the body needs iron, and the body needs the globin, which is the protein part. So when there is pure red cell aplasia, or when there is aplastic anemia, then there may also be due to anemia of kidney failure. So when the kidney is unable to produce the hormone which is required, that is erythropoietin. There may be pernicious anemia also when the vitamin B12 is deficient. Folic acid deficiency can also cause anemia. Iron deficiency may also cause anemia. There may be anemia due to erythropoietin deficiency, like I rightly mentioned. Then thalassemia can also cause the anemia, because this one it prevents the synthesis of globin, and we know that globin is required for the formation of hemoglobin. Now, the anemia, that is anemia due to impaired or decreased red blood cell production. Now, what about anemia due to increased red blood cell destruction, which we call hemolytic anemia? So it occurs or characterized by this and increased lactate dehydrogenase. So on this note, we can have hereditary spherocytosis, we can have hereditary elliptocytosis, there may be A beta lipoproteinemia due to deficiency of enzyme pyruvate kinase and hexokinase. Then it will also occur when glucose phosphate is deficient, and when glutathione synthetase is also deficient. There may be hemoglobinopathy, there may be sickle cell anemia. Resource disease may also cause hemolysis of red blood cells, like we rightly mentioned when we're talking about resource incompatibility. Transfusion reaction we also call blood, because when incompatible blood is being transfused to someone, it may also lead to anemia. Then due to infection such as malaria, anemia will also occur when there is heart surgery. Then hemodialysis may also cause anemia. Also, some parasites may also cause anemia, such as trypanosoma congolensis can also cause this. So what about the anemia due to blood loss, which is the third category? Now, when there is trauma or surgery, road traffic accident, when there is GIT lesion, and this one example of it is peptic ulcer. When someone has peptic ulcer, there will be blood loss through the GIT system. There may be gynecologic disturbances. Example of this is menstruation. We have a lady who usually has menstruation between 3 to 5 days. We now have her having menstruation for about 7 to 10 days. And think of the amount of blood loss. So this may also lead to anemia. Then there may be due to cancer or infection, such as nematode infection. Then anemia may occur when there is hookworm infection. Then there may be iatrogenic anemia, when someone requires blood test and the blood is being withdrawn over time repeatedly. This may lead to anemia. Then the fluid overload. So this may cause decrease in hemoglobin concentration and anemia may occur. So diagnosis. How do we know if someone has anemia? There is a test we call Hematocrit, which is also known as PCV, packed cell volume. So this of an individual when it is measured. So it tells us the ranges of the blood in percentage. So usually for female, we can have the range around 36 to 42%, and for male, we can have it around 40 to 48%, and it ranges. So how do we prevent occurrence of anemia? Eating food that are rich in iron and B vitamins. Eating fruits and vegetables rich in vitamin C. This helps the body to absorb iron adequately. Then also get tested at least yearly in order to detect if the condition is occurring, so that it could be arrested in the early stage. Then what are the treatments for anemia? So treatment for anemia depends on its causes and severity, just like we have mentioned. But we know that the main reason for causes of anemia may be due to deficiency of vitamins, if not for hemolysis and for the blood loss, which is hemorrhagic anemia. So if it is due to deficiency, then oral iron. So oral iron, application of oral iron can help in correcting the deficiency of iron in the body. So there is a particular report that says about two-thirds of children and women of childbearing age have deficiency of iron, but they do not have anemia. However, one-third of them, they have iron deficiency with anemia. Iron deficiency anemia due to inadequate iron intake is rare in men and postmenstrual women. However, oral iron supplements can be used to treat this condition. Injectable iron. In cases where oral iron has either proven ineffective or too slow, or where absorption is impeded, iron is injected, and this could be given with erythropoietin so that the process of erythrocytosis could occur at a very reasonable period. Also, another intervention could be through blood transfusion. Blood transfusion is in people without symptoms is not recommended until when the hemoglobin is below 60 to 80 gram per liter. That is about 6 to 8 gram per deciliter. So your doctor will advise you on how and when to have blood transfusion. Then vitamin B12 intramuscular injection. So injection of this vitamin in severe cases or cases of malabsorption of dietary vitamin B12. Also, there will be erythropoietin stimulating agents. If this is used, it can also help. Then there may also be hyperbaric oxygen supply. Thank you so much for following our video. We do hope that you've learned one or two things. Anemia is a very severe condition, and if it is not detected early, it can lead to a lot of fatality. And that is why we need to know our state, we need to know our full blood count, we need to know the percentage, and we need to monitor this, essentially in women, in children, majorly pregnant women, in children, and also in individuals that are doing tasks that requires a lot of energy. Thank you so much for watching our video. Make sure you like the video, comment, subscribe, click the notification bell so that you can be notified when we have subsequent videos. Thank you so much. Bye for now.